Before entering the patient's room, I'll assess any doorway signs for isolation precautions or fall risks. I'm going to perform hand hygiene and assess the room for any environmental hazards, and there are none. Hi, my name is Priscilla. I'm going to be your student nurse today. Can I get your full name and date of birth?
Bailey Hotels 8/12/98.
Okay. Do you know where you are?
John Tyler.
And what's today's date?
4/13/17.
Okay. Patient is alert and oriented to person, place, and time. She appears well-nourished and clean with adequate hygiene. She's sitting in the upright Fowler's position. Her facial expression is relaxed with no signs of facial drop or ptosis. I'm going to go ahead and get a set of vitals: blood pressure, respirations, pulses, temperature, as well as oxygen saturation are all within appropriate ranges, so I'll continue my assessment. Are you in any pain? Okay. If the patient was in any pain, I would assess and document using the mnemonic old carts. Can I get you to, get you to look at my eyes while I shine this light into yours. And then follow the pin. Very good. Pupils are reactive to light and dilated 2 millimeters. Can I get you to open your mouth? And can you swallow? Okay. The oral cavity is pink and moist as it should be, and the patient does not have any difficulty swallowing. Her speech is clear and articulate, as well as having appropriate responses. Can you take a deep breath and cough for me? Okay, good. There is no mucus associated with her cough. If there was, I would assess the consistency and color. I'm going to take a look at your hands. The nail beds are pink, with a capillary refill of less than 2 seconds. There's no signs of kynosis or clubbing. Now I'm going to auscultate your anterior breath sounds. Take a deep breath in. All right, and I'm going to listen to the posterior. Okay, lung sounds are clear bilaterally. So now I'm going to just go ahead and listen to your heart sounds. Using the diaphragm of my stethoscope. Aortic, pulmonic, Erb's point, tricuspid, and mitral valve for 1 full minute. And then simultaneously palpating the radial pulse. And they are equal. The S1 and S2 sounds, heart sounds, are heard with a regular rate and rhythm. I'm going to go ahead now and listen again using the bell of my stethoscope for any abnormal heart sounds. Are no abnormal heart sounds. What I'm going to do now is go ahead and lower your bed, or just examine your abdomen. All right. And her abdomen does appear flat and appropriate size for her weight. I'm going to go ahead and listen for vowel sounds. There are active vowel sounds in all 4 quadrants. I'm going to lightly palpate for any distension or abnormal masses. And there are none. Are you tolerating your diet well? Mm-hmm. Right. And when was your last bowel movement?
This morning.
Are you passing gas? Okay. How about urinating? Are you having any difficulty? And what would you say the color and clarity is?
It's clear and pale yellow.
Okay, good. If the patient had a catheter, I would go ahead and assess the Foley bag now for the color, quantity, and clarity of the urine. I would inspect any drainage tubes at this point. Any kinks in the tubing I would go ahead and fix. If she had any dressings, I would assess those to make sure that they're intact and there's no edema or redness and that there's no skin breakdown. I'm going to go ahead now and check your sensation and temperature. So I'm going to use the back of my hands. Can you feel? Can you feel? Can you feel? And feel? Okay, good. So the patient has sensation to the upper and lower extremities bilaterally. Her skin temperature is warm and consistent with the rest of her body. Her skin is dry and she does have an elastic skin turgor. And the skin color is consistent with her ethnic background. So now what I'd like for you to do is, can you pull for me and push? Can you raise your hands above your head? Good. And let's see your feet. Can you pull up and push? And can you lift your knees to your chest? Good. So the patient has full range of motion in her upper and lower extremities bilaterally. I'm going to go ahead and note at this point that the patient has symmetry of her head, her eyes, her ears, her mouth, as well as her shoulders, her hips, and thorax. There are no lesions or breaks of skin. And what I'm going to do now is check for any pretibial edema. And there is none. I'm checking posterior tibial pulses, dorsalis pedis pulses, and they are equal in strength and 2+ bilaterally. I'm going to check your radial pulses, and they are 2+ bilaterally as well. If the patient was on any supplemental oxygen, I would check the flow rate as well as the appropriate fitting of the nasal cannula. And if she had SCDs, TEDs, or foot pumps, I would go ahead and inspect for appropriate usage as well as comfort. And if there's any IVs, I would check the IV fluid as well as the insertion site for redness, edema, or skin breakdown. At this point, if the patient is on bed rest, I will go ahead and reposition every 2 hours, assist to a side chair if needed. I would document any intolerance to activity, or if she's using any ambulatory aids. And I'm going to go ahead and lower the bed to the lowest position, ensure the bed rails are up appropriately, and lock the bed. I'm going to make sure the call bell is within reach. If there is a bed alarm indicated, I'll go ahead and make sure it's activated now, and then document my findings.